My name's Katherine Lessman. I was born and raised in Omaha, Nebraska. I went to college in Northeast Missouri, came back here for med school, trained in St. Louis, and then practiced out in Spokane, Washington for a while. My dad was a doctor, and I was always interested in it from the combination of science and just the human element. And honestly, in college, I tried to make something else fit, and I just couldn't. I kept coming back to medicine. I love women's health for a variety of reasons. You get to follow people through the lifespan, from adolescence all the way through advanced age, and it's a career that you can personalize. You get to give good news more than you give bad news. When it's bad, it's really bad, but it's important to do that well. It's very personal, and it's great variety. To first sit down with a patient, we have a few minutes to get from strangers to intimately involved in the fine details of their lives, and to figure out what her concerns are, what my concerns are, to bring those together and to work through what her fears are unique to that situation, whether it's an adolescent who probably doesn't need a pelvic exam, but we need to figure that out together, or someone who's in a pregnancy but she's lost one or two or has cause for fear, and trying to figure out how to best work through this, which fears are validated, which ones maybe I can help assuage, but regardless to figure out what the next steps are going to be together. In academic medicine, you're always being watched, so you always have to be at the top of your game. You have to know what you're doing inside and out. If you can't teach it, or if you can't do it well, you can't teach it well. And so it gives the best you can to your patients as well as to the students. Omaha is my home point. It's always been my reference point. My family is here. I have a large family, and they were a big part of bringing me back. The move back was also expedited by my own family situation. I have 3 kids, and the youngest is a heart baby. So when we made that diagnosis, I really had to dig into what's going to be in her best interest and in the best interest of the other kids. And even though we weren't living here yet, we did make the decision to have her open heart repair done in Omaha. So this is a medical community I've always really respected, and the evidence on so many levels backs that up.